And we are back. Today we're tackling the topic I get the most questions about: memory and brain health after 60. Now, let me tell you an interesting statistic. Up to 40% of dementia cases could be prevented with the right lifestyle choices. So I prepared 20 questions that could genuinely protect your brain in the years ahead. Let's see what you know, starting with question 1.
All right, first question. How much of your body's oxygen supply does your brain consume? A, about 10%, B, about 20%, C, about 35%. The answer is B, about 20%. Your brain is only 2% of your body weight but demands 20% of every breath you take. This is why anything that improves circulation, exercise, hydration, even proper breathing directly benefits your thinking and memory. Question 2. Which activity has been proven to increase brain volume in seniors? A. Playing familiar card games. B. Learning a musical instrument. C. Watching educational documentaries. B is correct. Learning a musical instrument. Brain scans show that seniors who take up piano, guitar, or any instrument develop increased gray matter in multiple regions. Familiar card games maintain what you have but don't build new territory. Documentaries are passive. Music demands coordination, timing, memory, and creativity all at once. Here's question 3, and most people get this wrong. What time of day is your brain best at solving complex problems? A. Early morning right after waking. B. Mid-morning around 10 a.m. C. Late evening before bed. The answer is B. Mid-morning around 10 a.m. Your brain needs about 2 hours after waking to reach peak performance. Cortisol rises naturally in the morning, reaching optimal levels around 10 a.m. This is when analytical thinking and concentration are strongest. Save your most demanding mental tasks for this window. Understanding your brain's daily rhythm can transform your productivity. After that mid-morning peak, most people experience a dip between 1 and 3 p.m. when body temperature drops slightly and drowsiness increases. A second, smaller peak often occurs in the late afternoon around 4 to 6 p.m. Memory consolidation happens best during sleep, which is why studying before bed can improve retention. For seniors, these patterns may shift earlier, with peak performance arriving closer to 9 a.m. Pay attention to when you feel sharpest and schedule important tasks accordingly. Fighting your natural rhythm wastes mental energy. Question 4. Which common medication type can impair memory in seniors? A. Blood pressure medications. B. Antihistamines for allergies. C. Low-dose aspirin. B is correct. Antihistamines for allergies. Many over-the-counter allergy and sleep medications contain anticholinergics, which block a neurotransmitter essential for memory. Studies link regular use to increased dementia risk. Check with your pharmacist about alternatives if you use these frequently. Moving to question 5. How quickly can dehydration affect your cognitive performance? A. After several days without enough water. B. Within hours of mild dehydration. C. Only when severely dehydrated. The answer is B. Within hours of mild dehydration. Just 1 to 2% dehydration, barely enough to feel thirsty, measurably impairs concentration, short-term memory, and reaction time. Your brain floats in fluid and depends on proper hydration to transmit signals. By the time you feel thirsty, your brain is already affected. Question 6. Which type of fat is most essential for brain cell membranes? A. Saturated fat from butter. B. Omega-3 fatty acids from fish. C. Trans fats from processed foods. B is correct. Omega-3 fatty acids from fish. Your brain is nearly 60% fat, and omega-3s, particularly DHA, form crucial components of brain cell membranes. People with higher omega-3 levels show slower brain aging and better memory retention. Aim for fatty fish twice weekly, or discuss supplements with your doctor.
Quick checkpoint, how's your score looking? Keep count and share your total in the comments when we finish. I read every single one.
Question 7. What happens to your brain's ability to filter distractions as you age? A. It improves with experience. B. It declines, making focus harder. C. It stays exactly the same. B is correct. It declines, making focus harder. The prefrontal cortex, responsible for filtering irrelevant information, weakens with age. This explains why background noise bothers you more now or why you lose focus more easily. Working in quieter environments and minimizing multitasking helps compensate for this change. Question 8. Which sleep stage is most critical for memory consolidation? A. Light sleep in the first hour. B. Deep slow-wave sleep. C. The moments right before waking. The answer is B. Deep slow-wave sleep. During this stage, your brain transfers information from short-term to long-term storage. Seniors naturally get less deep sleep, which partly explains age-related memory changes. Avoiding alcohol before bed, keeping consistent sleep times, and sleeping in a cool room all promote deeper sleep. Here's why this matters so much for your memory. During deep slow-wave sleep, your hippocampus essentially replays the day's experiences and transfers important information to your cortex for permanent storage. Studies show that people tested on new information perform 40% better after a night of quality sleep compared to the same time spent awake. Disrupting deep sleep specifically, even while allowing total sleep time to remain normal, significantly impairs this memory transfer. As we age, we spend less time in deep sleep and wake more frequently, fragmenting this process. Strategies that enhance deep sleep include regular exercise, which increases deep sleep duration, avoiding caffeine after noon, and maintaining a cool bedroom around 65 to 68 degrees. Question 9. How long does it take for new brain cells to mature and integrate into memory circuits? A. A few hours. B. About 4 to 6 weeks. C. Over 2 years. B is correct, about 4 to 6 weeks. Yes, your brain grows new neurons even after 60, primarily in the hippocampus. But these newborns need weeks to mature and connect properly. This is why benefits from exercise or learning take time to appear. Stick with new habits for at least 6 weeks before judging results. Halfway there, question 10. Which sense, when stimulated, has the strongest connection to memory recall? A. Vision. B. Hearing. C. Smell. C is correct. Smell. The olfactory bulb connects directly to the hippocampus and amygdala, your memory and emotion centers. This is why certain scents can instantly transport you decades back in time. Some researchers are exploring aromatherapy as a memory enhancement tool for this reason. Question 11. What percentage of brain neurons are active when you're doing absolutely nothing? We have A. About 5%, B. About 20%, and C. About 95%. The answer is C, about 95%. Even at rest, your brain is extraordinarily active, consolidating memories, processing emotions, and maintaining body functions. This default mode network is where daydreaming and self-reflection occur. Constant stimulation never gives this network time to work. Question 12. Which leisure activity showed the strongest association with reduced dementia risk in long-term studies? A. Reading books, or B. Dancing, or C. Solving puzzles. B is correct, dancing. A 21-year study in the New England Journal of Medicine found dancing reduced dementia risk by 76%, more than any other physical or cognitive activity studied. Dancing uniquely combines physical exercise, mental engagement, social interaction, and music, hitting multiple protective factors simultaneously. This study from Albert Einstein College of Medicine followed seniors for over 2 decades and tested various activities. Reading reduced dementia risk by 35%, which is significant. Crossword puzzles showed 47% reduction, but dancing stood alone at 76%. Researchers believe the combination is key. You're exercising, which improves blood flow. You're memorizing steps, which challenges memory. You're often socializing with partners or groups. You're responding to music, which activates multiple brain regions. And perhaps most importantly, dancing requires split-second decision-making as you react to your partner and the rhythm. Even simple dancing at home to your favorite music provides benefits. Question 13. How does bilingualism affect the aging brain? A. It has no measurable effect. B. It can delay dementia symptoms by several years. Or C. It accelerates cognitive decline. B is correct. It can delay dementia symptoms by several years. Studies show bilingual individuals develop dementia symptoms 4 to 5 years later than monolinguals, even with the same amount of brain pathology. Constantly switching between languages builds cognitive reserve that compensates for age-related changes. Question 14. What role does your gut play in brain health? A. None, they're separate systems. B. Gut bacteria produce chemicals that affect mood and cognition. C. Only affects digestion, not thinking. B is correct. Gut bacteria produce chemicals that affect mood and cognition. The gut-brain axis is a two-way communication system. Your gut bacteria produce neurotransmitters like serotonin and GABA that influence brain function. An unhealthy gut is now linked to depression, anxiety, and possibly cognitive decline. Fermented foods and fiber support beneficial bacteria. Question 15. Which emotion is most toxic to brain tissue? A. Sadness. B. Anger. C. Loneliness. C is correct. Loneliness. Chronic loneliness triggers inflammatory responses that damage brain tissue over time. Studies show lonely individuals have 40% higher dementia risk, regardless of other factors. Brief periods of solitude are fine and even beneficial. Persistent feelings of isolation are genuinely dangerous to your brain. Question 16 now. What happens to brain connectivity during periods of boredom? A. It strengthens memory circuits. B. It weakens neural pathways over time. C. It has no effect on brain structure. B is correct. It weakens neural pathways over time. The brain operates on a use-it-or-lose-it principle. Unstimulated neural pathways gradually weaken and may eventually be pruned away. This doesn't mean constant entertainment, but regular mental engagement, variety, and challenge maintain the connections you've built. Moving on to question 17. How does laughter physically affect your brain? A. It only affects mood temporarily. B. It increases oxygen intake and releases protective endorphins. C. It has no physical effects beyond facial muscles. B is correct. It increases oxygen intake and releases protective endorphins. Genuine laughter involves deep breathing that floods your brain with oxygen. It releases endorphins while reducing cortisol. People who laugh regularly show better memory function and lower rates of cognitive decline. Humor is brain medicine. Question 18. Which common habit reduces blood flow to the brain by up to 30%? A. Drinking coffee. B. Skipping breakfast. C. Smoking cigarettes. C is correct. Smoking cigarettes. Nicotine constricts blood vessels throughout your body, including those supplying your brain. Long-term smokers show accelerated brain shrinkage and higher dementia rates, Quitting at any age begins reversing this damage, with blood flow improving within weeks of stopping. Almost there. Question 19. And this one is interesting. What is the relationship between teeth and brain health? A. No connection exists. B. Gum disease is linked to cognitive decline. C. Only affects nutrition, not the brain directly. B is correct. Gum disease is linked to cognitive decline. Chronic gum inflammation allows bacteria to enter the bloodstream and potentially the brain. Studies find people with severe gum disease have higher rates of cognitive impairment. Brushing, flossing, and regular dental care protect more than just your smile. Final question. If you could only do one thing to protect your brain starting tomorrow, which has the strongest evidence? A. Take a daily memory supplement. B. Walk briskly for 30 minutes most days. C. Complete crossword puzzles daily. B is correct. Walk briskly for 30 minutes most days. While puzzles help and certain supplements have modest benefits, cardiovascular exercise has the strongest, most consistent evidence for brain protection. It increases blood flow, promotes new cell growth, reduces inflammation, improves sleep, and lowers dementia risk more than any other single intervention.
Those were your 20 questions. So what's your score? Drop it in the comments. I want to see how you did. If you learned something new, subscribe and leave a like. Until next time.